Dear colleagues, my name is Dr. Michael Weber from Germany. Today I want to show you the so-called interstitial photodynamic therapy of a breast cancer patient. This is our patient. Her name is Susanna. She comes from Prague and she's 52 years old. Her history in short, she found a node in her right breast about 2 years ago, but she did not do anything. She rejected chemotherapy operation. She only was treated with natural things like herbs and different other things. In November last year, she came to me for first treatment, and unfortunately, she had a lot of problems with her brain, and 2 brain metastases were detected. She went to the University Clinic of Göttingen in December, and both metastases were removed successfully. But still, the problem remains the breast cancer, and the cancer was growing a lot. Galina, can you please move this? So just before this treatment, I show you the right breast, and I marked already the area what I have seen in the ultrasound check. And you see that here is already an ulceration area. And also we found about 5 lymph node metastases here in the axilla area. Okay. Susanna got liposomal indocyanine green photosensitizers 4 days ago. We're treating a breast already with external infrared laser therapy to stimulate the indocyanine green. We're also treating her with therapeutic ultrasound, low power ultrasound, and also shockwave to activate the photosensitizer with laser light and also with ultrasound. Now, after 3-4 days, the photosensitizer is accumulated as a maximum in the tumor area, and I marked already the places where I want to put the needle inside. The problem in photodynamic therapy is that the laser what you apply from outside is absorbed in a high degree from the skin. The infrared laser, of course, has the best penetration, much better than red laser, but still there is an absorption of about 80% in the skin already. So if we want to reach the deeper layers of the tumor inside the body, is very difficult. We can solve this problem only if we give the needles interstitially. That means we put small fiber optic needles and fiber optic catheters about 1 centimeter deep into the tissue, very close to the tumor area, and then we irradiate inside the tissue interstitially. In the first step, we have now to sterilize the area and give a local anesthesia before we put the fiber optic needles inside. Okay. Normal sterilization with some alcohol. Okay. This is local anesthesia. We use scandicane, but also you can use lidocaine or something else. Okay? Mm-hmm. So I give the first injection. Is okay, Susanna?
Okay.
Okay. Give me a little bit for. Okay. Next one. And move forward and back and inject the local anesthesia. Okay. Clean a little bit, yeah. Okay. Next one. Still okay?
Okay, okay.
Ah, she's a brave patient, I know. Never complaining. Last one. Okay. This is done now, and now we will wait for about 2 minutes till the local anesthesia is working, and then we will insert the fiber optic needles and connect them to our laser modules. For the treatment, we are using this laser device. It can be equipped with a total 12 laser modules, and we can use different colors. We are working with indocyanine green, which will be stimulated by infrared light. So we have 6 infrared laser modules on this device, and the laser is coming out from the module, will go into the optical fiber and comes out at the end of this fiber optics. So for the therapy, we will put these small butterflies with a length of about 2 centimeters right on top of the cancer, around the tumor, and we will put a sterile fiber optics inside, and this fiber is coming out at the end of the needle and will then be connected to the fiber optics of the device, so that the laser beam which is coming out of the laser module goes through this fiber, will then be inserted in the fiber optics and comes out on the top of the needle right into the tissue. So in the next step now we will put the fiber optic needles inside the body close to the tumor area. So I'll start with the first one here. Okay. Yeah. It's not painful. If you have good local anesthesia, it's not a painful procedure. Next. Yeah. Okay, everything?
Okay.
Thank you. Fine. So that's number 5 and the last one. So now all needles are set. I will now in the next step remove the closer caps and insert the sterile catheter. You see, it's really not a difficult procedure. Goes quite quick. The main thing is a good local anesthesia so that it's not a painful procedure for our patient. In the first step, I will treat the breast more from the upper side. In the second step, I will treat also from the downside, and in the third step, I will also treat the axilla area where she already has 5 lymph nodes. We marked them already in the ultrasound. So in such big tumors, sometimes we have to do it in several steps. Okay. So all needles are successfully inserted, and in the next step we will connect them with our infrared laser modules. Okay, you see this is the connection. Put it in the connector, put it in the right position and fix it with tape. That's good. Next one. So you see, it is not a difficult procedure, but believe me, it is very, very effective. And it's the only way to bring the laser light with a sufficient concentration into the body to achieve a maximum photodynamic effect. last one. So everything is ready now, and we switch the device on. We are working with infrared light, so this light is a non-visible light, so you cannot see anything on the screen, but we are treating each point with 100 milliwatt infrared laser, wavelength 810 nanometers interstitially. The light is coming out of a fiber optics in an angle of about 20 degrees, and the power per square centimeter, which is coming out of the end of the fiber, is very high, is between 80 and 100 watt per square centimeter. Watt, not milliwatt. So it's a high amount of energy what we are giving in the area, and we can expect after some days that we can already see a reduction of tumor size. Thank you very much.